Good evening, everybody. My name is Dr. Shaurya Pratap. I am a medical officer of Mosaic Wellness India, and I'm going to present on the topic of coronary artery disease risk evaluation among youngsters of different communities of North India. So before I delve into the specifics, I would like to give you a general introduction about the topic and why we're actually doing this study. So cardiovascular disease is the most common global cause of morbidity and mortality. We already know that. Among them, Indians have a greater risk of developing coronary artery disease compared to with the Europeans, the Chinese. Now, among the Indians, there is a specific caste group variation where specific castes such as the Baniyaas and another endogamous group such as the Jatts, Sikhs, which are basically landlords in the Punjab and Haryana states, do have a greater propensity, a greater predisposition for the cardiovascular disease. Now, before I start, let me just, so that I don't get repetitive later, let me just explain how we're going to compare the different groups. So firstly, we're going to take up a risk factor. We're going to divide two groups. Firstly, it's going to be the Baniyaas, and we're going to compare them with the Jatts, basically the landlords. Secondly, we're going to compare the two different landlord communities in Punjab and Haryana. And finally, we're going to compare the same risk factors between the Baniyaas of Punjab and the Baniyaas of Haryana. So basically, how do we do this? We basically use simple cost-effective parameters to measure adiposity, such as the anthropometric indices, BMI being body mass index, waist circumference to waist to hip ratio, waist to height ratio. All right. And we use this to basically predict cardiovascular risks. These parameters can be monitored easily, even by non-technical people, and hence we actually use these parameters in this study. To begin with, material method, this is the waist height ratio. So waist height ratio is waist circumference in centimeters upon the height in centimeters. And if the ratio is less than 0.5, we consider that to be normal. If it's equal or higher than that, we consider that to be abnormal. In the blood pressure category, we actually take up if the systolic is less than 120 and the diastolic is less than 80, we consider that to be normal. Anything above 140 is considered hypertension, 140 to 159 being stage 1 of hypertension, and anything above 160, systolic, obviously, is considered stage 2. Now, the interpretation of the stress score. So we actually gave out questionnaires to people, and they gave us their perception of the stress. So 0 to 20 was good control over stress, 21 to 40 was low level of stress, 41 to 60 was medium level of stress, and 61 to 80 was high level of stress, and they kind of needed counseling. Now, finally, body mass index, obviously everybody knows what it is. It's basically dividing weight in kgs by the square of height in meters, and anything between 18.5 and to 22.9 is considered normal, and anything above 20 or equal to 25 is considered abnormal. Now, delving into the specifics, we're going to compare the risk factors in two different groups. Firstly, we're going to compare the Baniya groups and the landlord groups, which are the Jatts and the Jaats of Punjab and Haryana. So clearly, if we see even though the Jatts and the Jaats are kind of higher, they score higher in the overweight category, the propensity of obesity in the Baniya group is considerably and significantly higher across the table. We can see the waist circumference is higher in the Baniya groups, the waist to hip ratio is higher in the Baniya groups, even the waist to height ratio is higher in the Baniya groups. Now, coming to the comparison of the same risk factors between the Jatts Sikhs and the Haryanvi Jats, basically the landlord communities of Punjab and Haryana. So we can see that the Punjabi Jatts Sikhs are clearly higher in almost everything across the board. They're higher in the overweight, they're kind of obese, they have a higher waist circumference, they also have a higher waist to hip ratio, and they have a higher waist to height ratio. Now, comparing the same risk factors between the Punjabi Baniyaas and the Haryanvi Baniyaas, similarly, the Punjabi Baniyaas do have a higher propensity towards being overweight, being obese, having a higher waist circumference, having a higher waist to hip ratio, and having a higher waist to height ratio. Now, if we compare the low physical activity, the smoking and the alcohol intake among Baniyaas and the Jatt and Jats, basically the landlords of the Punjab and Haryana, we can clearly see that low physical activity is clearly greater and significantly higher in the Baniya group, and the alcohol intake is significantly higher in the Jats and the Jats. Similarly, this is a little paradoxical. If you see, the stress levels are considered to be low in the Baniya groups, but the medium level stress is also higher in the Baniya groups, and the low sun exposure is obviously, as you can see, it's higher in the Banya groups. So now if you compare if we just compare the intake of junk food, the high salt intake, the high sugar intake, and the high fat intake, we can clearly see that the Punjabi Jatt Sikhs do have a higher propensity across the board. And similarly, if we compare the low fiber intake, the whole grain intake, low nuts intake, and the low fruit intake, that is also specifically higher in the Punjabi Jatt Sikhs as compared to the Haryanvi Jats, except for the low nut intake and the low fruit, where they're kind of comparable. Now, if we compare the same thing between the Punjabi Baniyaas and the Haryanvi Baniyaas, you can clearly see across the board, you can see that the Punjabi Baniyaas are specifically higher when compared in the high junk food in the entire food category. Now the pre-hypertension. If we actually compare the pre-hypertension among the Baniyaas and the Jats in the Jat groups of Punjab and Haryana, we can see that pre-hypertension is clearly significantly higher in the Baniya groups as compared to the landlords. In the Punjabi Jats and the Haryanvi Jats, we can clearly see that the Punjabi Jat Sikhs do have a higher propensity of having pre-hypertension in the families. Similarly, among the Punjabi Baniyaas and the Haryanvi Baniyaas, we see Punjabi Baniyaas do have a higher propensity of having pre-hypertension in the families. Now, the conclusion. Conclusion can be derived from all the graphs that I actually showed you. So clearly, there were deranged anthropometric indices were higher in Banya community. Low physical activity, 59% was more prevalent in the Banya community. Low and medium level stress was significantly higher in the Banya community. Alcohol intake, 68% was highest in the Punjabi Jatt Sikhs. Smoking was highest in the Haryanvi Jats, 25%, and lowest in the Punjabi Jats, less than 4%. Similarly, low sun exposure, 7% was more prevalent in Banya community. Faulty diet and junk food intake, 87.5% was significantly higher in the Banya community. And lastly, pre-hypertension, 33% was significantly higher for the Banya community. So this was the entire thing. I think I went through it a bit too quickly, but I think that is because of the time restraints that we were facing. So yeah, that was the presentation. Thank you so much.